Hello, my name is Alyssa, and I am here to speak to a case study on generalized anxiety. Patient is Adrienne Holdsworth, 39-year-old female. Adrienne is divorced with two children, a 12-year-old son and a 7-year-old daughter. She has a bachelor's degree in business administration and currently is a bank manager. Adrienne becomes worried as she notices a change in her concentration and memory. She schedules an appointment with her family doctor where no concerns are identified with her physical health, and a recommendation or a referral is made for Adrienne to a neurologist. Adrienne is seen by the neuropsychologist who assesses her cognitive function. Chief complaints are determined to be anxiety related, and a recommendation is made for Adrienne to seek support through an anxiety disorder. At the anxiety disorder clinic, Adrienne shares that she has made errors at work, causing her supervisor to advise her to take time off. Adrienne's mental well being is so negatively affected by her supervisor's comment, she leads herself to believe that her memory and concentration issues are so serious that they might be related to a bigger concern and may even be a result from experimentation with marijuana in high school. Adrienne reports that she's unable to relax outside of work, has low self esteem, and problems making decisions. She also reports that she is in a state of anxiety at least 75% of waking hours. Adrienne provides an example of excessive worry in her life, where she fears that her children may have been hurt or killed if they were playing outside the neighborhood, and she had not heard from them in a couple of hours. Adrienne reports excessive and uncontrollable worry. She is unable to dismiss worry and focus on a current task. Excessive worry at work, especially when her supervisor is present. Adrienne's concern of being perceived negatively has compromised her job performance and caused her to be less attentive at work, causing mistakes. And when she's experiencing these feelings, she reports becoming forgetful, irritable, having muscle tension, headaches, and problems getting to sleep and staying. Adrienne also reports an impact to her family and social life, stating she hates when she feels this way all day and just wants to be in control of her life. She reports working extra hours and states that she does so to make sure that she has her day as planned as possible. Adrienne also reports that her children have complained that she's always in a bad mood, and she notices she's spending less time with friends and experiencing an unsuccessful dating life. Clinical history for Adrienne: she states that she had a typical middle-class upbringing with both parents and two younger brothers. There is no known family history of emotional disorders, but she does report that her paternal grandfather experienced alcoholism. Adrienne reports being shy as a child, but still holding meaningful relationships and a status as an A student. At the age of 14, Adrienne and her family moved to an unfamiliar city and school where she tested high academically and was enrolled in honors classes. The first report of excessive worry was when Adrienne began her honors classes. She experienced anxiety that she would fail. Adrienne reported trouble sleeping before exams and issues with concentration and apparent fear of overarching failure. As a result of the fear of failure, Adrienne began procrastinating assignments and becoming more introverted. Parents, friends, and teachers noticed and offered to support Adrienne's mental health and academics, but increasing worry about college acceptance further perpetuated insomnia and anxiety. Symptoms would increase during high school and college years and would lessen during summer breaks and holidays. Adrienne met the man she married at college. Anxiety lessened in the first years of marriage, but after the children were born, Adrienne's husband had a desire to move out of country and take an academic position where at that time Adrienne's symptoms began to resurface. The couple disagreed on where to live and eventually divorced. Adrienne reports excessive worry when her children would travel and visit their father. Adrienne was diagnosed with generalized anxiety disorder as her principal diagnosis and alongside social anxiety disorder. Adrienne was also experiencing borderline hypertension and migraine headaches. The DSM-5 for generalized anxiety disorder states a person experiences excessive anxiety and worry about a number of events or activities and this occurs more often than not for at least 6 months. The person finds it difficult to control worry, and the anxiety and worry are associated with 3 of the following 6 symptoms: restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbances, most of which Adrienne has previously described or reported to doctors. A treatment plan and goals was developed for Adrienne. Adrienne's treatment plan is a combination of cognitive therapy, worry exposure, and worry behavior prevention. In Adrienne's treatment plan, she learns to identify thoughts and feelings of worry, assess the validity of her negative predictions or misconceptions, and navigate back to a reasonable and logical state of mind. When learning to prevent worrisome behavior, Adrienne is taught to identify and eliminate activities that have been engaging in their response to worry. This is done because these types of behaviors can maintain and strengthen worrisome. Adrienne's course of treatment was to self-monitor by keeping a diary of her thoughts and symptoms relating to anxiety. Adrienne's 2 most impactful areas of worry were identified to be performance at work and well-being of children. Adrienne's treatment focused on probability overestimation and catastrophic thinking as worry exposure techniques. She was to document and then later evaluate the accuracy of her predictions. The process was a way for Adrienne to experience worry exposure and validate the validity of those worries at a different time. To maintain this, Adrienne set aside an hour a day to reflect on her worries, and while doing so, she was asked to take 20 to 30 minutes to engage in a technique called imaginal exposure, where she could picture the outcome of what she feared the most. On the right side of the screen is an example of a worry control record that Adrienne documented over the course of her treatment. The outcome of her treatment was using the worry exposure techniques and imaginal exposure technique. Adrienne was able to gain a sense of control over her behavior. Because worry exposure provided her free rein to worry for a full hour each day, she was better able to dismiss the worries as they occurred naturally and know that she would be able to give them her full attention later. In total, Adrienne had 15 sessions of treatment. At the end of treatment, she reported 5 to 10% of her day consumed by worries and anxiety, where pre-treatment she reported at least 75% of her day was consumed by anxiety and worry. Reflecting on Adrienne's case, the first critical thinking question was, worry is the key diagnostic feature of generalized anxiety disorder. Because everyone tends to worry on occasion, what do you think differentiates normal worry from worry found in generalized anxiety disorder? Harvard Medical School put out an article called "Do I Have Anxiety or Worry? What's the Difference?" And in that article, it stated, symptoms of normal anxiety do not negatively interfere with daily functioning. They may actually improve your attention and problem solving, motivate you to work harder towards a goal, or warn you of a potential threat. My personal response to this question is very similar. Worry related to generalized anxiety disorder is a behavior that negatively impacts your physical health, mental well-being, and causes hardship to personal and cherished relationships. Much like Harvard stated, normal worry is going to push you, motivate you to continue down the path to accomplish whatever your goal is. Worry related to generalized anxiety disorder is going to hold you back. The second question states, do you believe that worry can have adaptive qualities? If so, what are they? And what do you believe are the negative consequences of worry as related to generalized anxiety disorder? An article published by Psychology Today called "Turn Your Worry into a Superpower" states that worry is designed to alert us of danger and give us energy to manage the issue and find a solution. I do believe that worry has adaptive qualities, much like stated in the article from Psychology Today. Some of the adaptive qualities of worry can be motivation and preparation. The negative consequences of worry is when these activities, such as preparation, impact our lives and responsibilities and commitments negatively, or we become so fixated on solving an issue that it consumes the majority of our time. An example of this might be staying late at work to prepare for something and having that impact plans with your family. Next question states that research indicates that unlike many other disorders, generalized anxiety disorder has gradual onset that frequently dates back to childhood. Why do you think this is the case? And do you believe that the tendency to worry excessively is more like an enduring personality characteristic than a symptom that occurs acutely from time to time? Um, I believe that worry associated with generalized anxiety disorder dates back to childhood for three reasons. The first reason being a genetic predisposition to anxiety. Children who are born to families with high anxiety or a history of mental health disorders are more likely to experience mental health disorders of their own. Second, environmental factors can impact children when they experience treatment that elicits fear, harm, or stress. Children are learning to cope using their developing brain and potentially creating lifelong behaviors and unhealthy coping strategies. And third, the temperament of a child can also lead to worry behavior and anxiety. Shy and introverted children who naturally and organically prefer solitude, independent play, and develop a stress response to group activity or exposure, which can create an unpleasant response or anticipation for specific events and activities and create lifelong avoidance. Um, when asked, do I believe if it's more of a personality characteristic or a symptom that occurs acutely from time to time, I think that it's both. I think that um, anxiety and tendency to worry excessively can grow over time, especially from childhood, as I just stated, or if managed appropriately and the person has the ability to manage appropriately, it can be something that occurs acutely from time to time. Lastly, in addition to the strategies discussed in Adrian's treatment, what other methods do you think would be helpful in treating people with generalized anxiety disorder? Adrian's treatment consisted of cognitive therapy with specific identification and coping techniques to manage her fears. In addition to cognitive therapy, I believe that lifestyle changes and pharmaceutical intervention with medication can also be beneficial to someone experiencing generalized anxiety disorder. Lifestyle changes, such as adjustments to an unhealthy diet or eating behaviors or exercise and relaxation, can help tremendously. Um, Excessive caffeine, greasy, fatty, or highly processed food can increase anxiety. Incorporating more one ingredient foods into a daily diet is a fast way to make healthy changes. Um, and then I think relaxation and self care can have a huge impact if a person can commit to even as little as 15 minutes a day set aside for themselves to do whatever brings them peace. Pharmaceutical interventions have also shown great progress in some people using SSRIs or SNRIs, which happen to be the most commonly prescribed medication for anxiety disorders, but there also are other options and natural alternatives. In conclusion, I think the most interesting or surprising part of the case to me was that Adrian's unawareness of the repeated behavior. Um, as the case continued, it seemed obvious, but to her, it obviously was not obvious. As stated in the case, Adrian's symptoms have been the same for all of her life from when she was 14 and in high school, and then well established into her career. This is interesting to me because I think it's relatable for so many people. We often don't identify our own patterns and behavior, it takes someone else to point them out. As I read and considered my own patterns of behavior, I was able to draw parallels to personal themes. The most engaging part of the story to me was to consider the details from Adrian's case and reflect on my own behavior. Thinking about, am I someone who experiences anxiety and constant worry? When I have experienced catastrophic thinking, how can techniques like worry exposure help me personally? And how can I gain control of the thoughts that wreak havoc on my everyday life? I think that reading a case about something that you might personally experience can be very eye opening and relatable, and help you understand the disorder on a deeper level, but also might help you understand yourself. These are the references that I used for the case study. Thank you for listening.